On Friday, the 5th of October, a digital transformation summit was held in Dorset, which involved clinicians and IT teams from the Royal Bournemouth and Poole hospitals and their partner organisations. During the summit, there was a very strong emphasis on patients and their care, with the key message to involve patients now in new digital technology which is being planned for the future in Dorset.
I have to say the thing that blew me away was our patient representatives. We had 3 patient representatives, one who came and spoke about diabetes, then the 3 of them joined cafe sessions we had talking about their journey, their experiences, and that was the most powerful bit.
I'm a type 1 diabetic, so I'm a patient, and I'm very interested in how the technology can help me manage my diabetes. I've talked today about a particular piece of technology called a patch, and how that provides much more information to help me improve my health and improve the health of the population.
Lots of interesting questions and discussions about what we can do with the data, what the data really means, and what data is missing, what data we need to bring into that, and more importantly, what we can do for patients. So it's starting to be the beginnings of a community of people interested in trying to do something with the data to try and improve the care for patients.
Probably one of the biggest differences between this and the last IT summit was the importance of the patient centred in our development of IT systems.
Patients are a critical stakeholder in the whole process, and it's all about them. So it's important that we make sure that the care we're delivering is what they need.
What I noticed is that when patients are speaking, everyone is absolutely fascinated by what they've got to say in a way that it creates a power to that conversation that you just don't get when you're talking theoretically about a patient experience, which of course we do all the time. And don't get me wrong, when clinicians are talking about it, they're much closer to it, but it's still a bit theoretical. It's a bit without the patient in the room. When the patients here were talking, everyone was just blown away by what they had to say and totally concentrating on that. And it just the sense was we started that co-design conversation. They were offering, what about if? Why can't we do it this way?
I think it's very important because it's going to the front line. Being the patient, you're able to say what works well, what doesn't, and working together, you can actually build a better system for other patients. If you get patients involved afterwards, you have problems where they can't actually do very much about it and they just don't really have a say. Bringing ideas together and to help find a better solution. Because there's a lot of information that I didn't really know about, and it's kind of made me actually reflect on how information can be used better, on how technology can help make the experience better for patients, but also clinicians and patients working together. What I would like to see being done is more connection with patients. So I would like to see a patient panel that can be tapped into, for example, for these experiences, so we can then join together and feedback. It's nice being listened to. I feel like I'm an equal, and before I've maybe not felt that, and now I'm feeling like my voice does matter. I am being listened to.
Digital brings with it the potential for patients to be far more involved in their own healthcare, to contribute to helping us help them get better in a way that hasn't been possible before. It'll be possible for patients to see their own healthcare information in the future, I expect, and even to correct when that's not been accurately recorded, which currently isn't detected very often.
So I will make a pledge that if I ever have a development on the boil in pharmacy, I will make sure I'll involve a patient, most definitely.
And I was really pleased to see the focus on the patient and the digital benefits that can be brought to the patient. So all in all, very, very impressive morning.
How important are patients in everything we do digitally?
They're at the heart of it, and part of that is about responding to the new world, what they want, enabling people to take power, to take ownership of their own condition, particularly for long-term conditions. I think we need to hear more voices from the public. There will be far more opportunities for them to contribute to the record, and we need to enable that to co-produce with the public. And part of that is about recognising it's their journey, not our journey.
We don't want to stand still. We want to make the patient experience the best experience, but not just about patients, about clinicians and staff and everybody that's involved with patient care. I believe working together with patients is incredibly important, because at the end of the day, we are an industry that is providing a service to an audience, which is our patients. They are stakeholders. For us to know what our patients want, a patient who's coming to the hospital for the first time, who may be a little bit scared, they don't know what's going on, they don't know what's wrong with them, how can we make that experience calmer, kinder, more interactive and more informative, so they go away not only hopefully being happy with what they've been told, but actually with the information they've been given and how they can move forward themselves for the future if they need to come back to us.